Global health for too many years has been dominated by the global north. The crisis we are now facing creates the opportunity to build a global health system that is more equitable and more inclusive than what we had before. So what we see is a culmination of challenges in global health. We have a triple burden of disease, infectious diseases, non-communicable diseases, and the impacts of climate change. And that is coupled with an erosion of trust we see within societies, between countries, geopolitical fragmentation, and shrinking fiscal space for global cooperation. And that is even compounded by the remaining lack of access, equitable access to innovation and healthcare. Really, I believe global health is at a crossroads, and we need to come together. It's not only about policy and financing, but what we need is new leadership and cooperation in this space.
So what can we do to promote more inclusive and equitable global health outcomes?
I think that is probably the biggest challenge. We have seen tremendous progress in science and research, in technological innovation, but it obviously has not reached most of the planet so far. I think if I look at how global health has developed over the past 20 years or so, we have made a lot of progress. We've seen child mortality halved. We have seen diseases like polio almost eradicated. But what we have also seen, and that's my personal view, that some of these systems are not working in the way they used to work. And what we have not achieved is that we have not really built resilient health systems all around the world.
So how do you think technology plays a role in it? Will it widen the gap or close the gap?
It usually happens both at the same time. So when new technologies, when innovation is coming, it's often only accessible for a small portion of the population. But on the other hand, technology creates efficiencies which can then allow to roll out systems on a new level. And especially if you think about more resource constrained settings, especially in the global south, in low and middle income countries, I believe technology can play and must play a huge role in closing that gap.
How do you view the role of China in shaping global health governance, especially in South-South cooperation?
I think China itself has made huge progress in extending healthcare, universal health coverage among its population. China is a leader in technology and the application of AI. So there is a wealth of wisdom and knowledge that can actually be applied. It's obvious that we see a fragmentation in geopolitics. And I believe with the crisis we are going through, there's actually a chance. Global health for too many years has been dominated by the global north. The crisis we are now facing, as they say, never waste a good crisis, creates the opportunity to build a global health system that is more equitable and more inclusive than what we had before. That allows the global south not only to participate in the discussion, but really have a seat at the table and co-create solutions with other countries. And I think China plays an important role as it is an economic powerhouse, but still considers itself part of the global south. So I think that's a strong position China has, and I hope China is going to use that in a good way.